Hello, my name is Daisy, and I am going to be doing the checkoff for administering injections, sorry. So the first thing that I want to do, the first thing I'm going to be doing the subcutaneous medication. So I'm going to be doing insulin for this purpose. I have the insulin syringe here. So I have that here. I have my alcohol swabs. I have the insulin vial, so we're going to be doing regular insulin today. And for the purpose of this video, my patient is going to be this demo skin. So first off, I want to make sure that I look at the patient's information in their medication record to make sure that I have the correct medication. So I have regular insulin. I already checked the patient's blood sugar, and it is 250. And the order is for 5 units of regular insulin daily. So it's okay to give the insulin. And so I have the correct insulin, and then I check that it's 5 units for the right patient. The patient does not have any allergies to the medication, so we're okay. I went ahead and checked the expiration date for the medication, and it is August of 2022, so it's okay to give. And it was opened 3 days ago, so the medication is still okay. Okay, so now that it's time to prepare the medication, I am going to go ahead and perform hand hygiene. And once hand hygiene is performed, I'm going to go ahead and grab this alcohol swab, open it, and swab the vial and let it air dry. And while I'm waiting for that, I'm going to go ahead and grab my syringe and my needle and draw up 5 units of air. Okay, so there we go. We have 5 units. And after we let the vial air dry, I'm going to go ahead and grab the vial and put the air into the vial. Okay, I'm going to go ahead and draw up 5 units of the medication. Okay. So I'm going to go ahead and put this up, which is a safety device for the needle. I'm going to go ahead and make sure that I have 5 units of the medication here. And I can also confirm with the second nurse, make sure that I have 5 units of regular insulin. Okay, so let's say that I already double checked it with the second nurse. I'm going to put the syringe on the wax paper. And then before putting this away, I'm just going to double check that it's regular insulin, 5 units for the correct patient. Okay, so that has been double checked. Alrighty, so we are outside of the patient's room. And outside of the patient's room, I'm going to check the medication against the medication mark against the actual vial of the medication one more time, which is going to be my triple check to make sure that I have the right medication, right route, right dose for the right patient and at the right time. Once I walk into the patient's room, I'm going to wash my hands, perform hand hygiene, and put on some gloves. I will identify the patient by using 2 identifiers. I can use the patient's first and last name as well as the date of birth. And I'm going to explain to the patient that I'm going to be administering the 5 units of regular insulin that is scheduled daily for him. And then the patient is already aware that that his blood sugar is 250. So like I said, I've already performed hand hygiene and provided some privacy and put on some gloves. The first thing that I'm going to do is explain to the patient where I am going to be administering the medication. So for this purpose, I'm going to be administering in the back of the arm, but I could also give it on the thigh. I could give it right here in this fatty area in the back. I could also give it in the scapula if it's needed. But for this purpose, I'm going to give it in the back of the arm. Okay, so this is going to be my patient, and we've already identified the patient with 2 identifiers. Okay, so like I said, I've already explained the patient what we're doing. I'm going to go ahead and grab the alcohol prep pad and clean the patient's skin. Okay, I'm going to dispose of that. And then now I'm going to grab my syringe with the 5 units of regular insulin for the patient. Okay, and make sure that it's the correct dose. Once I have the medication ready, I'm going to go ahead and grab the patient's skin and pinch it. And I can insert the medication at a 45 to 90 degree angle. So we're going to go ahead and do that. And here we go. 1, 2, 3. Okay. And then since the medication is already administered, I can go ahead and draw up and do the safety needle device on here so that I don't get injured and my patient doesn't get injured, and dispose of this in the sharps container. Okay. So after the medication has been administered, I'll just provide some patient education, make sure that they know to take a snack if they're feeling a little bit dizzy, or if they're having any signs and symptoms of hypoglycemia. I would document in the MAR that the medication has been administered, how many units, and what part of the body it was administered. So for this scenario, it was administered on the right arm. I would go ahead and come back in about 15-30 minutes to make sure that the patient did not have any adverse reactions to the medication and that they are not having any signs and symptoms of hypoglycemia. And I would also document that the patient did not have any adverse reactions to the medication. Okay, and just lastly, like I said, we just want to make sure that we record in the patient's record their response to the medication, and if they don't have any adverse reactions, to put that in the records. Before leaving, make sure that the patient is safe, bed and lowest position, call light and personal items within reach, perform hand hygiene, and that would be it for this checkoff.